Nowadays, we come across many parents who tend to Google their child's symptoms and treat accordingly. But this can often be risky and dangerous. There are some very minor issues which, if you look up the internet, you may get very worried and worked up that your child has some grave disease. And on the other way around, there are some things which should be treated on time, which may be ignored for a few days and be treated at home by seeing the internet. So I'm here to help you guide regarding this. Hello everyone, I'm Dr. Nirali Thakkar, pediatric surgeon at Jaydeep Hospital. Let's discuss few of the symptoms which we tend to Google. Groin or scrotal swelling in boys can be due to hernia, hydrocele or testicular torsion. While hernia requires a planned surgery, hydrocele sometimes does not require surgery at all. But testicular torsion needs to be treated immediately. Otherwise, the child may develop gangrene of the testes and the testes may have to be removed altogether. So, do not ignore this and show your surgeon immediately. If you feel your boy's penis looks different from the others, it could be due to phimosis, when we are unable to retract or pull back the foreskin of the penis, or it could be due to an anomaly called hypospadias for which surgery is required. Only a pediatric surgeon will be able to check and tell you the difference. If your baby is continuously crying and putting her hands and legs up over her tummy, whether this is really just a harmless colic or an intussusception which requires emergency surgery, can only be seen and checked by a pediatric surgeon. If your child is having blood in his potty or stools, even if it is just 1 or 2 drops of blood, don't ever ignore. Always get it checked by a surgeon. It can be something as simple or harmless as a rectal polyp which requires a minor surgery, or it could be something major like a Meckel's diverticulum which is bleeding. Each reason for the bleeding has a different cause and a different treatment which only a surgeon can tell. Repeated vomiting in children should also not be ignored. What is important is how frequently they are vomiting and what color it is. If at all the child is having a green color vomit, a pediatric surgeon should be seen immediately, as very often this requires a surgery. If your child is having repeated crying while passing urine, it could be burning sensation while passing urine, which can be present due to a urinary infection or due to stones. Sometimes even a minor skin issue can cause this problem. So the internet is there to give you all the information, but not the correct diagnosis. So if you have any of these signs or symptoms, don't just Google, visit a pediatric surgeon so that the correct care is given to your child on time and emergencies are avoided. In case of any doubts, we are available round the clock for your child. Thank you.